I say every time you pick up a rock in the healthcare RCM world, you find 3 more rocks underneath it, and I imagine it's probably similar for your business. You know, it's fractal complexity all the way down, which with each one of these processes.
Absolutely, absolutely, and I think, if I were to sort of paint the picture of what it looks like, for a day in the life, let's say a credentialing team member, right, at, let's say, a large health system or a clinic, no matter the size, it's really sort of maintaining like tons and tons of like tribal knowledge, right? Of, you know, like you kind of alluded to, right? All this variation and edge cases and things are always changing. And so you think you have something solved, right? And then all of a sudden the rules change and you have to adapt to that very quickly. Um, there's lots of that. There are, as we kind of talked about, there's specific rules, across different health plans and different states that folks always need to track, and they're changing just rapidly, right? We see that, and it happens oftentimes without a rhyme or reason, and you have to adapt very quickly and make sure that, you can still stay on track. And so, I really think that folks and organizations in this space, people that work in this space, they to this point, they've had to do this very manually. There hasn't been sort of, a source of truth or rules engine, right? That one could track and use to actually help drive, these processes forward. Um, a lot of what, we think about when trying to build a shirt is actually build that source of truth, right? And we think a lot about it a lot in terms of like TurboTax, right? I don't know what I would have done, in terms of filing taxes, whether it's at the state level, at the national level, especially when moving, I would not be able to know, right? What the regulations were and what information I had to share. TurboTax makes that so easy, right? It tracks all of that for me and just sort of asks me what the information that it needs in order to sort of make sure, I file my taxes correctly. That is ultimately what we're building with the shirt, right? Across credentialing and health plan enrollment and various other problems in the healthcare back office is let's build this sort of operating system or orchestration system that can actually run these processes on autopilot and sort of maintain all these rules for you so you don't have to.